Hi, I'm Dr. Rosa Stakes. Today, I want to talk about something that might feel a bit personal but is incredibly important: how common medications can impact erections. Many men don't realize that the pills they take every day for various health conditions can affect their sexual health, sometimes in unexpected ways. Have you ever stopped to wonder if the medication prescribed to manage your blood pressure, anxiety, or depression might be influencing your ability to achieve or maintain an erection? If so, you're not alone, and it's a question worth exploring. Sexual health is a vital part of overall well-being, and erectile function plays a key role in that. When changes happen, especially those linked to medications, it can cause frustration, confusion, or even embarrassment. But understanding the connection between your medication and sexual health is the first step toward managing it effectively. That's why I encourage you to think about your own experiences with medications. Have you noticed any changes in your sexual function since starting a new prescription? Maybe you felt less desire or found it harder to maintain an erection. These are common concerns, and they deserve attention. I'd love to hear your thoughts on this topic. Have you ever talked to your healthcare provider about how your medications may be affecting your erections? Or perhaps you've hesitated to bring it up because it feels awkward or you're unsure if the symptoms are related. Sharing your experiences in the comments can help break the silence and create a supportive conversation. Your story might even help someone else who's hesitant to speak up. So please take a moment to share. Your input matters. Now, as we move forward, keep in mind that this discussion isn't about discouraging you from taking your prescribed medications. These drugs are often essential for managing serious health issues, and stopping them without medical advice can be dangerous. Instead, it's about raising awareness and encouraging open dialogue with your healthcare provider. Together, you can find solutions or alternatives if side effects are impacting your quality of life. So, what kinds of medications are we talking about? There are several common categories known to affect erectile function. Blood pressure medications, for instance, are a frequent culprit. Drugs like beta blockers and diuretics can reduce blood flow, which is crucial for achieving an erection. When blood flow is compromised, it can lead to difficulties that range from mild to more pronounced challenges. Then there are antidepressants, especially selective serotonin reuptake inhibitors, or SSRIs. These medications are vital for mental health, but they often come with sexual side effects, including reduced libido and problems with erection. Anxiety medications and treatments for prostate conditions can also play a role. It's important to remember that everyone's body reacts differently. What causes noticeable side effects in one person might not affect another the same way. That variability makes it all the more important to monitor your symptoms and communicate openly with your doctor. If you're experiencing changes in sexual function, don't assume it's just normal aging or something you have to accept without question. Sometimes, a simple adjustment in medication or dosage can make a big difference. Before we dive deeper into the specifics of how these medications affect erections and what you can do about it, I want to remind you that your concerns are valid. Sexual health is a key part of well-being, and it deserves the same attention and care as any other aspect of your health. If you're struggling with these issues, you're not alone, and help is available. Now, if you've ever been curious or concerned about how your medications might be impacting your sexual health, please share your thoughts or experiences below. Your voice adds to the conversation and helps others feel less isolated. Together, we can create a space where men feel comfortable discussing these important topics with honesty and without judgment. Let's continue this journey with openness and understanding, knowing that knowledge is power when it comes to managing your health. I look forward to guiding you through the facts and solutions in the next part of our discussion. Many medications, while essential for managing health conditions, can have side effects that influence erectile function. It's a complex issue because these drugs are designed to treat serious problems, but sometimes their impact on the body extends beyond the intended effects. For example, certain blood pressure medications like beta blockers and diuretics are known to reduce blood flow. Since an erection depends on adequate blood flow to the penis, anything that interferes with circulation can potentially lead to difficulties in achieving or maintaining an erection. Beta blockers work by slowing down the heart rate and reducing blood pressure. While this helps protect your heart, it may also narrow the blood vessels slightly, limiting the blood supply needed for an erection. Diuretics, often called water pills, help remove excess salt and water from the body to lower blood pressure, but they can also reduce the volume of blood circulating, which again affects the blood flow necessary for sexual function. These side effects don't happen to everyone, but they're common enough that they deserve consideration if you're facing issues. Antidepressants are another major category linked to sexual side effects. Selective serotonin reuptake inhibitors, or SSRIs, are among the most commonly prescribed antidepressants. They work by balancing serotonin levels in the brain to improve mood, but this same mechanism can dull sexual desire and interfere with performance. Men taking SSRIs often report reduced libido, difficulty achieving erections, or delayed ejaculation. It's important to know that these side effects are not universal, and some people tolerate these medications without any sexual problems. However, if you experience such symptoms, it's worth discussing with your doctor because there may be alternative treatments or strategies to minimize these effects. Medications used to treat prostate conditions, such as 5-alpha reductase inhibitors, can also influence erectile function. These drugs reduce the size of an enlarged prostate and relieve urinary symptoms, but may cause sexual side effects, including erectile difficulties and decreased libido. Similarly, some medications prescribed for anxiety or other mental health conditions might affect sexual performance by altering hormone levels or nervous system function. The key takeaway here is that medications' impact on erections varies widely depending on the drug, dosage, individual health status, and other factors. Not every man taking these medications will experience problems, and when they do, the severity can range from mild to significant. This variability can make it challenging to pinpoint the exact cause without professional guidance. That's why it's crucial to have an honest conversation with your healthcare provider if you notice changes. Never stop or adjust your medication on your own, as this can lead to serious health risks. Instead, share your concerns openly. Your doctor can evaluate whether your medication might be contributing to the problem and explore options such as switching to a different drug, adjusting the dose, or adding treatments specifically for erectile dysfunction. Sometimes, managing these side effects means balancing the benefits of the medication against the drawbacks. In some cases, the medications are life-saving, and sexual side effects may be a trade-off. But in many situations, there are ways to improve or restore sexual function without compromising overall health. Your healthcare provider is the best resource to help you navigate these choices. If you're experiencing erectile difficulties and suspect your medication might be involved, keep a record of when symptoms started and any changes in your prescriptions. This information can help your doctor identify patterns and make informed decisions about your care. Remember, you're not alone in this, and help is available. If you found this information helpful, please like, subscribe, and share to spread awareness. Understanding the connection between medications and erectile function is a vital step toward better health and well-being. Your support means a lot and helps us continue providing clear, accurate medical information.